Warning, this content will most likely make you throw up. Please don't watch this while eating. Watch a cat video instead. He gets in there for the pelvic exam and finds a dead frog in her vagina. Gynecologists, what is the strangest thing you have experienced during work? I'm a GP, but I see a lot of vaginas and do a fair amount of basic women's health. A few interesting ones. Total duplication anomaly of the vagina. One vagina went to the uterus, one ended in a blind pouch. They were Catholic, so when they wanted a baby they went in one hole, if they didn't they went in the other. I've seen multiple extra nipples and breasts. One case I saw as a student was a lesion in the vaginal area. Ended up being ductal carcinoma, breast cancer. Two really old lesbians came in, one was really sick. She had a retrouterine abscess. The bacteria cultured was from the mouth. Evidently the one with really bad teeth got her nasty mouth bacteria up in her partner and got her very ill. I've had to fist people on several occasions post-birth to stop heavy bleeding. On 2 occasions I had to use instruments to scrape out retained placenta from the uterus. I had a placenta hit me in the face once. I literally had run to the delivery and didn't have time to gown up. Had to deliver barehanded as well, which whatever, at 3 a.m. in residency I didn't care too much. Not me but my mom, who was a labor nurse, was taking care of 2 women during labor who were impregnated by the same man. She's also walked in on people in the act within an hour or 2 of delivering. Keep in mind women usually bleed quite a bit for many hours after delivery. A woman who appeared to be pregnant that actually wasn't. This was in India. She had tuberculosis of the uterus and her abdominal cavity kept swelling. Quite surprising when we did the ultrasound, at least to me. All the docs there had seen this at least once before. A mildly obese woman with a growing abdominal mass. CT showed a calcified mass that appeared to be a uterine tumor. Sent her to gynecologic oncology. She had half a dozen documented negative pregnancy tests in our office as well as at the gynecologic oncology's office. He sent her for an ultrasound to get some additional views. It was a 20-week-old fetus. Neither I, nor the woman ever felt it move, but it was alive and healthy. I still feel bad about that. Poor kid got about 200 chest x-rays worth of radiation in utero. Remember folks, lab tests aren't infallible. My dad is a gynecologist. 2 stories he tells always makes me chuckle. The first was when he was a resident he was doing a breast exam on a morbidly obese woman. We're talking somewhere in the 600 to 700 pounds range. As he lifted her breast, he found a soggy, half-eaten cookie. The story made its rounds around the hospital, and eventually he had people he didn't know telling him, "Did you hear some resident found a cookie under a patient's breast?" Second story was when he was doing a pelvic exam on a woman with a prolapsed bladder. At some point during the exam, when my dad's face was in a relatively close distance to the patient's area, she violently coughed. A spray of sharp misted my dad in the face. He assured the patient that it happens all the time and he had to excuse himself from the exam room because he was trying not to laugh hysterically. My gynecologist told me a story of a very sweet old lady who was her patient. She was getting frequent yeast infections and my doctor told her that yogurt was good for vaginal health. Cue to the next appointment and they go to do the pelvic exam and lo and behold this poor, sweet old lady had strawberry Yoplait smeared in and around her vagina. Not me, my aunt. She had one patient that had an infection so bad you could smell her from down the hall. When they took a sample and sent it down to the lab, this is the conversation that happened over the phone a while later. Lab: "Okay, this isn't funny. I know you nurses have a twisted sense of humor but that went too far." And, "What the hell are you talking about?" Lab: "Come on April, you know what you pulled. You didn't send us human flesh." The woman they were examining had used some kind of phallus-shaped pork as a sex toy and it wound up rotting inside of her. They gave her antibiotics and told her to never, ever use anything for a dildo besides a manufactured sex toy. My sister's boyfriend was doing a gyno rotation. He was quite upset, as he was examining a woman that from sight and smell alone it was obvious she had cervical cancer so advanced that she wasn't going to make it. For the first time on that rotation he had to warn someone about their imminent death. It was all very depressing and solemn, so it was quite a relief when it turned out to be a tampon that had been in there long enough to resemble a tumor. I had a professor who once worked at a hospital and this woman came into the ER complaining of a purple discharge from her vagina. While the nurses asked her questions, the woman said that she used a cervical cap as her form of birth control. They then asked what type of jelly she had been using in the cervical cap. She replied with Welch's. This woman had been using grape jelly instead of spermicidal jelly in her cervical cap. This is a story from a friend's dad, happened 3 summers ago. An overweight woman comes into the office for an STD test and pelvic exam, complaining of colorful discharge, an awful stench, and burning during urination. She assumes she has gonorrhea. Wrong. It was much worse. He gets in there for the pelvic exam, all the while assaulted by the stench of rot, and finds a dead frog in her vagina. This thing is heavily decomposed, since the warmth of the woman's vaginal cavity has helped to speed up the process, and he has to pull it out piece by piece. Needless to say, she also had a wicked UTI. The woman explained that she'd passed out naked and drunk at some party at her boyfriend's house, and figures he or one of his friends must have thought it would be an absolute riot to put a live frog up her vagina. She apparently did not seem bothered by the fact that an animal had died and decomposed in her vagina, just relieved she didn't have gonorrhea. For extra gross out factor, it's worth knowing that this was in Memphis, Tennessee, where temperatures routinely get well over 100 F with over 90% humidity. Think about that. Not a gynecologist myself, but I assist in a sexual health clinic. Specifically, I assist IUD insertions. For those of you who don't know, this is a fairly painful procedure involving passing instruments through the cervix, usually without anesthetic, and some women don't react well to it. Vomiting and fainting aren't uncommon, as are screams of pain and a certain amount of flailing. This one patient we had was a teenage girl, probably 15 or 16. She was very sweet, and brought her friend with her for support. After the procedure was complete, but the speculum was still in her, she suddenly went pale and fainted. When she fainted, though, she also peed on the doctor. When she came to a few seconds later, we got her oriented again and she seemed fine, until she realized she was sitting in a puddle of her own blood and urine. She was also on her period, in front of 3 other people. She was so embarrassed she started crying, and when we finally got her cleaned up she tried to sit up too fast and fainted again. In the end she was fine, but it was by far the most eventful day I've ever had there. Not a gynecologist, but I was an intern in a hospital in Saudi Arabia. I was shocked to find out they hand out officially stamped virginity certificates to young girls who are looking for marriage or are about to get engaged. The groom's family demands one, by the gynecologist department. In another thread there was a doc who posted. He said he would basically lie to keep the girls from being ostracized or killed. I wish I could find it. I talked to an older nurse named Gertie, who was relating the nastiest experience of her career. The triage had admitted a stripper and escort that did private parties. She was blonde, 5 feet 4 inches, and 140 very athletic pounds. The private parties she did apparently got very wild. Her intake form listed coke, weed, alcohol, meth, and a very extensive list of prescription pills. Her reason for visiting the ER was that she was having trouble peeing and noticed an unusual odor coming from her vagina. Although some medications can compromise one's immune system, it seemed unlikely that any of the drugs she'd taken would cause that amount of damage to her bladder, but there was a very serious concern for kidney failure. The ER doctor, we'll call him Dr. Bliss, had the patient disrobe and put her feet in stirrups. When she did, Dr. Bliss and Gertie were assailed by the foulest stench ever and both ran from the room, vomiting all the way to the bathroom. When they regained their composure, they returned to the examination room to find the patient screaming hysterically and bawling her eyes out. They put on masks, didn't help, and proceeded with a standard pelvic examination. This is what they discovered. Periodically, the patient would pick up dollar bills with her labia and spit change out of her vagina. Apparently she'd forgotten to remove some change after her last gig 3 weeks prior. They treated her for toxic shock syndrome and put her on a course of general antibiotics. They also advised her to find a new party trick. After Gertie got done telling her story, all the young nurses stopped eating and mostly just sat in horrified silence. I'd seen some wild stuff, but nothing like that. At least not the way Gertie related the story. During my obgyn rotation, a woman came in with a clove of garlic stuck in the vagina, used as a home remedy for yeast infections, which actually is not that uncommon of a complaint. But when going to retrieve it, a fly of some sort flew out as soon as the speculum was placed and opened. It must have wanted out for hours, if not days, with the vigor and speed at which it flew out of this girl's vagina. To this day I'm wondering if it was a maggot in the garlic and hatched, how it lived in there, etc. One woman came in with a light bulb jammed in her cervix. The removal was apparently very difficult, fearing that the glass would break inside her. Her reason for it being in there was that she fell on it. Another woman had put a can of tuna all around and inside her vaginal opening and then allowed her cats to eat it. One of the more extreme cases I saw was rather recently of a gal that had Mayer-Rokitansky-Kuster-Hauser syndrome. Her womb was about an inch deep. Well, her vagina was that deep anyway. She had working ovaries, but the womb being so non-existent meant kids was a no-go. She had to use a dilator to stretch her vagina over the course of 6 months to a year, and the size started small, but grew as her vagina stretched. Puts what some of us go through into context. One patient in particular stands out in my mind. About 4 years ago, I had a new first-time patient visit the office. She didn't stand out at first, and when I saw her walking through the office, I figured she would just be a typical patient. However, after a few minutes of talking to one of my assistants, I was called into her room to check her out. I found it strange, because I usually come in near the end of the examinations. When I went in the room, I saw why I was called. Her vagina was just gaping. I mean, it was ridiculous. It was almost perfectly circular, and looked wider than John Goodman's neck. Now, I had seen many women in my work before, but this was just strange. I wondered, did she recently give birth? And if she did, was it to the alien baby from Prometheus or something like that? While still in shock, I quickly went over to her chart to check her vitals. It finally dawned on me why her nether regions were that way. That patient was your mom. Thanks for listening to Radio TTS. Well done for making it to the end of the video. Hit the subscribe button and activate the notification bell for more videos. Click the right box for the related playlist. Let us know in the comments what your favorite story was.